Welcome to virtual knee surgery. This activity will show you the process of replacing a failing knee joint. Are you ready? Today, our patient is a 76-year-old man. It is mandatory to check the patient's vital signs before beginning surgery. An anesthesiologist in the operating room performs this step. If the patient's vital signs are not in the normal ranges, we will not proceed with the surgery. Using the healthy person's vital sign chart as a reference, can our patient undergo surgery today? It looks like surgery will proceed as planned. Take a moment to look at our patient's x-rays. Which knee do you think needs surgery? Sorry, his right knee appears fairly normal. His left knee appears worn down and lacking cartilage, which is likely the cause of his pain. The nurse has begun prepping our patient for surgery by placing an IV needle in his right hand. Now it's your turn. Use the marker and write your initials on the proper knee to be operated on. This may seem silly, but it's an actual step taken to prevent wrong site surgeries. Nope. The anesthesiologist administers drugs through the IV and through a mask over the patient's face. What function should these drugs perform? No. Good work. Great. Nope. Fantastic. After the patient is unconscious, and before the first incision is made, we need to establish a sterile field around the surgical area. A series of sterile drapes isolates the surgical field from the rest of the patient's body. A tourniquet is applied to cut off blood flow, which allows a clearer view of the surgical field during surgery. To kill the bacteria on the patient's leg, clean it in a betadine solution. This scrubbing process will limit the chance of bacterial infection. Betadine scrub is applied 2 more times, followed by the final arrangement of sterile drapes. Why do you think knee surgery involves so many drapes? Good work. Use the sterile marker to draw the location for our incision, and don't forget to mark the perpendicular lines too. Typically, the incision line is 6 to 7 inches long. Nope. Nope. No. Outstanding. Now for the incision. Take the scalpel and cut the skin following your markings. Let's use the Bovie pencil to cauterize the veins. This will help decrease blood flow into the surgical field. The rake retractors fold the skin and tissue out of the way, exposing our patient's knee. To operate, we need the patient's knee elevated and bent so the bones are fully exposed. Now the leg is at the proper angle. Use the rongeur to remove the anterior cruciate ligament, or ACL, the meniscus, and any bone spurs that may be lurking about. Are you a good sculptor? It's time to shape the femur, tibia, and patella so the new knee components fit properly. A hole must be drilled inside the femur to set up the distal femoral cutting jig and alignment device. The jig is put into position and helps ensure that the cuts made to the bone are exactly what are needed. Now hammer in the pins to hold the jig. We can now remove the alignment device. The pins will hold the jig firmly in place. Now for some real bone shaping. Use the bone saw to cut the bone so it is prepared for the new femoral component. Another cutting jig, along with the bone saw, allows us to finish shaping the femur. Let's move on and shape the tibia. The tibial cutting jig is aligned with the big toe and the highest point of the tibia. This will ensure the leg is properly aligned after surgery. Secure the jig in place with more pins. Use the bone saw to cut off the top of the tibia and prepare it for the new tibial components. Now we'll use the patellar cutting jig and bone saw to remove the back of our patient's patella. Holes in the tibia and patella are drilled and chiseled out, which will enable the new components to attach properly. Time to place the trial components. First, attach the femoral trial component.